The work that I'm presenting tonight is actually done not only by myself, but with my team sitting over here. Dr. Sean Sukal, my fellow, who's in the yeoman's job here. Leonard Bernstein, Kathleen Robbins, our research coordinator. Wendy Beneventano, one of our laser nurses, and Tracy Muhlenforth. And I thank them for participating in this and making this a very interesting project for us. It's so far quite successful, and I think, as Zach mentioned, something that will get even better as we begin to tweak the parameters and improve the technology. So far, we have done 58 full face and neck treatments with the device. And this has evolved over time. My focus will not be on the histological side, but more on the clinical side in terms of what we've done. Our treatment protocol at this point in time is to use topical anesthesia. We give nerve blocks. We give intramuscular toradol. This is a bit more uncomfortable than the traditional Fraxel. We don't need the blue, not only for this, but for the Fraxel 1500 as well. We don't need that nice rolling tip. Has made life much, much easier. Afterwards, we do some soaks, and we use some Aquaphor healing ointment, and we've gone anywhere from 1 to 3 treatments per patient. Healing is very quick, very different than what we had experienced with traditional CO2 laser resurfacing, which would take at least a week to 2 weeks, and then we'd have persistent redness that would last for months. It's not the case here. Generally, we're healed in 3 to 5 days, and very interestingly, as you'll see in some of these slides, when patients come back for a second treatment, they heal even faster. So something's going on in the skin, so when you do the second treatment, the healing is significantly faster. And the redness sometimes goes away in a week, occasionally up to 4 weeks, depending upon the depth of the treatment. Our parameters have been anywhere from 10 to 70 millijoules. We've just started to work with 70 millijoules. We're delivering 100 to 300 microthermal zones per centimeter squared, and anywhere from 3 to 1,600 microthermal zones total over a surface area. Long-term complications, and this is key. We've not had any scarring. We've not had persistent redness. I'm talking about something that lasts for months. And I think most importantly, we've not had hypopigmentation. This was one of the big problems with traditional CO2 laser resurfacing, in that when these patients would come back, they'd have their upper lip done, and it looked like that I Got Milk commercial. You know, you see the white upper lip, and the rest of the skin looks normal. And you can see those patients a mile away. You can tell they had a peel, they had laser resurfacing, they had dermabrasion. That's not happening here, and to me, that's big. Now, here's one of our patients, and if you look, you can see pre-treatment on your upper left. And here she is 1 week post-treatment, just some mild redness. 2 weeks after treatment, actually, 2 weeks later. This is 6 weeks post-treatment number 1. 4 months afterwards, 1 week after a second treatment, and look at the difference after that 1 week. We actually went with a higher energy with that 1 week post the second treatment. 2 weeks post-treatment number 2, and 3 months. And let's look at her in a close-up. On the upper lip, which is one of the areas that responded very nicely. You see those smoker lines? Look at her now. 3 months post-treatment number 2, how those lines have flattened. No evidence of persistent redness. And in my opinion, if you don't get the persistent redness, you're not going to see the delayed hypopigmentation, which is something Dr. Bernstein and I reported on about 10 years ago. And here she is pre and post. And I think it's a great thing to get these deep lines out in such an easy fashion. And I think we're going to be doing a lot of this, people coming in just to have their upper lips done without concern for the discrepancy in color and with a good result such as this. If you look more closely at the rest of her face, you can see on her cheeks that her pore size has diminished and the overall texture of her skin has improved as well. Here's another patient, and one of the beauties of this, as Zach mentioned, is that you can treat the neck. And the neck has been a very difficult area to treat. We're doing very well with the 1500, but there's some cases where you have these deeper lines and this coarse roughness that you see in this patient where it's just too deep for the 1500. And if you look at her here immediately after treatment, not a big deal. 3 days, she has some wounding and some redness. At 1 week, just some mild redness. At 4 weeks, looking pretty good, much softer. 6 weeks afterwards, and then post-treatment number 2, some slight wounding. And look at her 3 days afterwards, just some mild redness, no big deal. So compare the 3 days post-treatment number 1 to 3 days post-treatment number 2, and you can see the faster healing, again, despite higher energies. And the reason we're using higher energies, as we gain confidence with this new device, we begin to get a bit more aggressive. So if you look at her here, you can see the considerable improvement. She had some flattening of the bands, which I really can't explain, the platysmal bands. It's an overall improvement of the texture of her skin as well. And here you can see some softening of those lines. And I would think that as we go along and we begin to look at our results more completely with higher energies and begin to get more aggressive in the treatments, we'll do even better than what you see here. Here's another example. Pre-treatment, post-treatment number 1, right afterwards. You get this petechial type of response. 3 days, some redness. 1 week, just some mild redness. They're back in makeup generally in 4 or 5 days. 4 weeks afterwards, 6 weeks afterwards. Post-treatment number 2. This is back we were using the blue dye. We didn't like to do that anymore. 3 days afterwards, you can see again the same phenomenon. 3 days post-treatment number 1 compared to 3 days post-treatment number 2. Less of a healing issue despite the higher energies. And you can see the results 3 months after the first treatment. And here again, you can see the softening of this coarseness on the neck, some tightening of the jawline, overall improvement. This patient's absolutely thrilled. The other area we're looking at is acne scarring. And this has worked out quite well also. You can see the response here. We're a bit more aggressive as we're treating these patients. Again, we began to increase the energy and the number of microthermal zones per patient. But here, even at 3 days, the healing is very quick. At 1 month, they do have some deeper redness, a greater deal for men than women who can wear makeup. And here, after treatment number 2, you can see the response, and 3 months later, and 1 week post-treatment number 2. And generally, you can see that we have improved his scarring quite dramatically, and something that we're excited about. And I would expect these patients to continue to improve for several months after the last treatment session. Here again, you get the sense that there can be some redness that will persist if one's a little bit more aggressive with the treatments. And here you can see the change in the texture, and as well as the overall improvement of skin quality, the depth of the scars. Sean Sakal came to me, and this is just a few days ago, and said, why don't we try to measure with the newer higher fluences that we can use, going up to 70 millijoules, using a caliper immediately after treatment. This is with a single pass at 300 microthermal zones, looking at 40, 50, 60, and 70 millijoules, and you can see that on your left here at 70 millijoules, there's more contraction than we see at the 40, 50, and even to the 60. So as we go along and begin to pursue these higher energies, I think you're going to see more tightening of the skin that will be clinically significant. The other advantage of using these higher energies is I think we can use this method with fewer passes across the skin surface. We started treating patients at 70 millijoules with just 1 pass, allowing for a much faster and more comfortable treatment. So that's where we're at for the moment. I'm looking forward to treating surgical scars, which hopefully will be starting soon, and then to optimize its parameters even further. Thank you.